All right, welcome everyone. This is the first episode of Fibromyalgia Success with Boydston Brain-Based Rehabilitation. This is Dr. Robert Boydston, and what I'm going to be doing is I'm going to be sharing with you some of the success stories that we have treating fibromyalgia patients with brain-based rehabilitation. And what that is a cutting-edge, very non-invasive way to treat and rehabilitate the neurological aspect of fibromyalgia. Because as most people know and have come to realize that it's a brain-based thing. That the pain originates in the brain, and even though you're feeling it in all these muscles, um, the brain really has to be the target or the focus. And so I'm going to be sharing some of the success stories that we've had because I think people just need to hear and know what's possible treating this disease because so many patients have lost hope. They've lost hope that they're not going to be able to live a day without having pain, without having fatigue, um, and feel like they're just going to be stuck with the pain pills and just stuck where they are in life. And it's not true, and you don't have to. And I hope that some of these videos will, if you're watching this, will help you understand or realize that help is out there, and there is new innovative ways to deal with fibromyalgia that can be extremely successful. And the first success story I want to share with you is Valerie, and she's a 48-year-old female. Now, prior to starting brain-based rehabilitation, she had pain for 5 years. Now, it didn't, she had it for a long time. Some people have suffered for 20. Some people have developed it and have only been suffering for a few months. But she had it for 5 years. And she tried physical therapy for about 2 to 3 weeks, and it only aggravated the problem. And this is something I see all the time, is fibromyalgia sufferers going towards some type of musculoskeletal physical type of care that just ends up making them worse. Because as you'll learn, and if you read some of my literature, that you'll find out that a lot of times that physical rehabilitation will exceed the metabolic capacity of the patient's brain, and it'll just flare up all the pain and make everything worse. And that's so common. And so she discovered after 2 to 3 weeks that was the case. It was not for her. It was not helping. So she just lived with it. She took pain meds, tried the new fibromyalgia medications, and all those really did is cause her to gain weight, make her feel groggy, make her feel like her brain wasn't firing right. So she had pretty much just given up on all of that, and she just lived in constant pain because nothing helped. So she started up care with brain-based rehabilitation, and in 5 weeks, she went from pain levels of 10 out of 10 down to 4 out of 10, which is incredible in 5 weeks. And after 12 weeks, after 3 months of treatment, her average pain level was 1 out of 10, but most of the time it was 0. But she still did have some pain. But from 10 out of 10 to 1 out of 10 is just incredible. And in her words, she says, "This has been the best thing I've ever done. It has changed my life completely." And if you're watching this and you want to get some more information about brain-based rehabilitation, I put some information out on the website. Go to Fresno fibromyalgiadoctor.com. There's a link right there that you can see on your screen, and on the right-hand side of that page, just click on that image, and there's a special report that I put together that goes through everything, that tells you what it is, how it works, and how it can make you help you relieve your pain. So that's episode 1 with fibromyalgia success with brain-based rehabilitation. I invite you to go visit that website now and find out how it would be possible for you to get rid of your pain. This is Dr. Robert Boydston signing out, and I will see you in the next episode.